Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing one more rare case in pathology, a rare case of malignant mixed epithelial and stromal tumor of kidney. And what we'll be doing is we'll be having a diagnostic. We'll discuss about a diagnostic approach, that how a detailed histopathological evaluation, and also very important is IHC, that is immunohistochemical marker, which has a very important role in making us arrive at a very rare diagnosis. And always when you make a rare diagnosis, what you have to keep in mind, you have to exclude all the commoner entities which can mimic this kind of tumors. So let's begin. So this malignant mixed epithelial and stromal tumor of kidney, MEST-K short form में कहते हैं. See, MEST-K जो होता है, mixed epithelial stromal tumor of kidney, it can be benign or malignant. So our tumor is malignant MEST-K. It is a very rare renal tumor. और malignant MEST-K मतलब हमारा malignancy is seen in both the components. क्योंकि लिटरेचर में बहुत केस रिपोर्ट हुए हैं जिसमें एक कंपोनेंट में या तो मैलिग्नेंसी एपिथेलियल में है या स्ट्रोमल में है. मोस्ट कॉमन तो बिनाइन मेस्ट की होता है. मैलिग्नेंसी में भी किसी एक कंपोनेंट में मैलिग्नेंसी है, या तो एपिथेलियल में या स्ट्रोमल में. बट in our case we had malignancy in both the components, that is epithelial and stromal tumor of kidney. So as I told, MEST-K usually it behaves in a benign manner, and majority of cases it is male-female ratio is 1:6, very common in female when you compare it with males, and that too in perimenopausal females. Now this tumor is typically it is solid and cystic. जैसा आप ग्रॉस आप जब दिखाऊंगी मैं आपको इस ट्यूमर इस केस का. So it is composed of spindle cell admixed of spindle cell stroma and epithelial elements. एपिथीलियम कैसे डिफाइन करोगे, जैसे आप देखोगे इसमें ट्यूब्यूल्स दिख रहे होते हैं, और बैकग्राउंड स्ट्रोमा जहाँ पे स्पिंडल शेपेड सेल्स जो बैकग्राउंड स्ट्रोमा में होते हैं. सो दैट इज योर एपिथेलियल एज वेल एज स्ट्रोमल कंपोनेंट. सो यूजुअली जो मेस्ट के था, जो मेस्ट मिक्स्ड एपिथेलियल स्ट्रोमल ट्यूमर, इट हैड जो हमने पढ़ा, जैसे बहुत सारे अलग अलग साइट्स पे भी मेस्ट होते हैं जहाँ पे एपिथेलियल एंड स्ट्रोमल ट्यूमर mass it forms a mass. So usually it is characterized by benign histology and clinical course, but malignant features in MEST, this has been identified very recently. So that's why very few cases, अभी जब एंटिटी हमें नहीं पता होती है तो we may not be able to. That's why see, adding to medical literature is important. So why we need to report even case report. This is the reason. See, if जब हम अगर ये केस जब हम कर रहे हो रहे थे, जब हम when we were doing this case or reporting this case in RML, so if we didn't have any idea about some entity that has been reported, so it would have been very difficult for us to go ahead with this rare diagnosis. Fine, तो हमने देखा कि हाँ ऐसा कोई केस लिटरेचर में भी रिपोर्ट हुआ है. So that's why when you write a case report, you add to medical literature. It is not that it is not important. Fine. So we report a first case of malignant MEST-K in literature with malignancy in both the components. जैसा मैंने कहा आपको, epithelial and stromal tumor both, and that too in a very young individual, in 30-year-old male patient. So coming to clinical history, how the patient presented with 30-year-old male patient. He presented with chief complaints of often on painless hematuria हो रही थी उसे for the last 6 months, and with passage of fluids. And he also had burning micturition, left flank pain, which was acute in onset and radiating to abdomen. And he also, recently he noted a large mass which was enlarging and occupying the left upper abdominal region. ठीक है? His baseline and the parameters जो हैं, basic parameters BP, blood pressure and pulse rate was within normal limit. Chest was bilaterally clear, but on per abdominal examination, what was found, it was noted that a lump of size 20 to 15 centimeter was present in the left lumbar region, and it was non-tender, mobile, hard and bimanually palpable. Lab investigation, basic parameters, complete blood count, liver function tests, kidney function tests, serum protein electrolytes, these were within the normal limit as was noted in the lab. Routine urine examination showed few RBCs, 50 to 20 per hyperfield. Normally you don't see RBC in urine, right? And pus cells also were there, 2 to 4 per hyperfield. However, culture was sterile and did not show growth of any organism. So ultrasound on radiology, what we got? A large, well-defined heterogeneous shadow which was measuring 14.6 into 13 centimeter, and it was seen arising from upper half of left kidney. So this is the CECT image. Here you can see a large mass, fine, which was occupying the left or abdominal region. Okay. So what, considering the large mass on CECT, heterogeneous ultrasound pay, we got like 13 to 14 into 13 size mass. Per abdominal examination showed in young age 38, the provisional diagnosis was given as renal cell carcinoma. So the surgery was done and we were sent with the kidney specimen. So see, this is the large left renal nephrectomy specimen. So here you can see, and so this is the cut section. So ये we had cut it, book like open करते हैं हम kidney को when we receive it. तो ये this is the one portion and this is the other portion. तो बीच से हमने यहाँ पे cut लगाया था. So this was the whole mass. B में देखो figure B. So this is the kidney we got in toto. Then we had cut it. और cut section में देखो what is this? These all are variegated appearance. किसको कहते हैं हम? Variegated means difference. कहीं somewhere it is gray brown, somewhere the mass is hemorrhagic, somewhere you are seeing multiple cysts. So remember the normal cut section of kidney, it is totally different. Fine, this is not resembling a cut section of a normal kidney. You are seeing a tumor within the kidney, fine, which has replaced the entire normal renal parenchyma. Fine. See one more appearance. Here you are showing a large tumor is seen. ठीक है, यहाँ पे देखो. These all are tumoral components only. This is a variegated appearance. Different. जैसे ये hemorrhagic area है. This is some fleshy grey white areas. Then necrotic areas. These small cystic areas are there. ठीक है. This was before fixing, and after it was fixed in formalin. तो आप B section image B देखो इसमें. So here also you are seeing nodular appearance, grey white. This is not at all resembling a cut section of a normal kidney. जिसमें आप cortex, medulla देखते हो normal kidney में, आप इसमें कोई भी structure it is not similar to your kidney sections. Fine. Then coming to histology findings. So we got it. We did the whole processing was done in histopath department, and then we got the ready slides, which was stained with HNE, that is hematoxylin and eosin stain. So आप पहले figure में क्या देख रहे हो? Here 4 images are there. Fine. First, it is a composite tumor. ठीक है, which is composed of epithelial as well as stromal component. ठीक है. So section image section B में देखो. Here what you are seeing, proliferative bland looking spindle cells हैं. ये सारे lumen जो आप देख रहे हो ना, these all are the epithelial component. ठीक है. और background में आप जो देख रहे हो ये सारे stromal component है. ठीक है. So what this is resembling a phylloid tumor. When you see breast का tumor का morphology, histopath, so this is just like a cleft leaf appearance जिसको कहते हैं ना, leaf like clefting जो होती है हमारी ये breast phylloid tumor में, जिसमें stromal overgrowth हो रहा होता है और ducts जो होते हैं वो compress हो जाते हैं. So it is having a similar appearance like that. ठीक है. So leaf like clefting with interspersed benign tubules. So इस section में we are seeing a benign component. ठीक है. तो benign हमें proliferation मिल रही है. ठीक है. Section C is showing what? Benign tubular epithelium है. ठीक है. Which is and hobnail appearance होती है. Hobnail appearance you can see here in figure D. Hobnailing, ये सारे जो होते हैं ना, ये lining tubules के जो lining epithelium है, these are becoming a shape of hobnail appearance having. ठीक है. फिर then we got few areas which were showing squamous epithelium with keratinization. ठीक है. A and B दोनों में आप देख रहे हो. Here you have your tubule and here you have your squamous keratinization. पर pearl squamous ring जिससे keratinization हो रही है वहाँ पे. ठीक है. So now we got the benign component. ठीक है. अब हमें malignant देखना है, और malignant हमें दोनों component में देखने हैं. हमारे epithelium में भी देखना है, stromal tumor में भी component देखना है malignancy का. So this figure is showing you malignancy in your epithelial component. तो इसमें क्या देख रहे हो? जो malignant cells है ना, 70% of the total neoplastic mass is comprised by this malignant epithelial cells, which are arranged in micropapillae. देखो micropapillae होता है ना, जैसे ये एक fibrovascular stalk है, उसके चारों तरफ से सेल्स हैं. ठीक है. यहाँ पे भी देखो एक फाइब्रोवास्कुलर स्टॉक एंड देन यू आर सीइंग द सेल्स अराउंड. फाइन. तो दिस आर Malignant epithelial cells which are arranged in micropapillae and papillae showing malignancy features, that is high NC ratio, then prominent nucleoli, vesicular chromatin, okay? Dense crowdly packed back-to-back arrangement of the cells, glands, and in D, added feature of necrosis, feature of malignancy is necrosis. So extensive necrosis you are seeing surrounding these tubules. Fine. So now we are done with that. Malignancy is there in your epithelial component. So now let's see the stromal component. इसमें क्या malignancy? Stroma में क्या है कि oval to spindle shaped cells वो herringbone pattern में fish जैसा होता है ना herringbone pattern से बीच में आप अगर straight line दो और ऐसे 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 ऐसे. So these all are herringbone pattern. The cells are arranged, ठीक है? But these are malignant stromal cells. क्यों? क्योंकि high NC ratio है, prominent nucleoli, occasional inconspicuous nucleoli दिख रहे हैं, and you have extensive necrosis. इस एरिया में देखो यहाँ पे स्ट्रोमल सेल्स के सराउंडिंग भी आपको यहाँ नेक्रोसिस जो डेब्री में एपिथेलियल कॉम्पोनेंट मिल रहे थे वो यहाँ भी मिल रहे हैं, ठीक है? एंड वन मोर इंपॉर्टेंट फाइंडिंग वाज दिस पेरिफेरल कफिंग. These are benign tubules and with the peripheral cuffing of these stromal cells. This is an added feature of MESTK. ठीक है? So here what you are seeing, यहाँ पे हमने एक सेक्शन में lymph node मिला था and we got mets in the lymph node also. Fine. So ये lymphovascular emboli है, ठीक है? lymphatic channel के बीच में lymph node का section है ये और उसी का high part you can see this epithelial component जो था छोटा सा epithelial tubule you can see it is within the lymphatic of the sections of lymph node which we got it. Ureter and the adrenal were free from the tumor. There was no evidence of tumor in the section of ureter and section of adrenal. Adrenal bhi we got in the specimen. So adrenal and ureter were free from tumor mets. But this lymph node showed one foci of this tubular epithelium. So now basis of this sections, based on just clinical and histopath examination, अब हम differential पे आ गए कि we are sure now that this is a renal cell carcinoma, but a variant कौन सा है? So we got क्योंकि sarcoma component ज़्यादा है, मतलब है present, तो we could keep a differential as sarcomatoid renal cell carcinoma and obviously malignant mixed epithelial stromal tumor of kidney. Other differential which you have to keep in mind is adult Wilms tumor. Usually Wilms tumor is seen in, it's a triphasic tumor. You see ectodermal, mesodermal and endodermal components in that. So usually it is seen in children, but adult Wilms tumor bhi hota hai. Then primarily renal synovial sarcoma. So these entities, these tumor entities you have to keep in mind before you label it as a definitive entity. So now role of so just basis of histological examination आप जो हमने चार differential रखे ना, how हम differentiate कैसे करते हैं, ठीक है? See sarcomatoid RCC ये 5% of renal cell carcinoma में दिखता है, ठीक है? इसमें क्या होता है, intermingled carcinoma and sarcomatous component होते हैं जो हमारे में है, but still we are not labeling it as malignant sarcomatoid RCC because in sarcomatoid RCC you see no benign epithelial or stromal areas, but in our case we had benign components in both epithelial and stromal areas. Extensive sectioning हमने करी. जब आपके पास ऐसा बड़ा ट्यूमर आता है ना, तो आपको multiple sections लेने होते हैं to label it as a definitive diagnosis. तो हमें सिर्फ नहीं कि malignancy मिली तो we'll go ahead with the malignant component. So we need to see other areas also कि if there is any remnant of benign foci. So here it is mixed malignant epithelial stromal tumor. ठीक है, benign component भी है epithelial stromal का, malignant component भी है epithelial और stromal का. तो इस point की basis पे we can rule out sarcomatoid. That is no benign epithelial or stromal areas are seen in sarcomatoid, but here we are getting it. So our that is malignant MESTK, it is composite tumor, and here you see benign and malignant epithelial and stromal elements. Composite मिलता है आपको, ठीक है? Then we come to primary renal sarcoma. इसमें क्या होता है, hemangiopericytoma like vascular pattern होती हैं. Biphasic tumor है, epithelial cells more cuboidal and polygonal as compared to your malignant MEST. Then no prominent subepithelial condensation of stroma जो हमारे में था. Peripheral cuffing का image दिखाया था ना मैंने कि बीच में renal tubule है और उसके surrounding peripheral cuffing हो रही है of the stromal cells. वो there is no condensation, prominent subepithelial condensation of stroma in primary renal sarcoma. And no typical benign mixed epithelial tumor to prove malignant transformation. हमारे में क्या था कि वो पहले benign MEST रहा होगा, उसमें अब malignancy के changes आए हैं, ठीक है? So benign MEST के with having now malignant transformation in both epithelial and malignant components. Then fourth entity हमारा adult wilm, that is I told you it is a triphasic tumor, usually seen in kids but can be seen in adult also. So you have your blastemal, stromal and epithelial elements. ठीक है? But see, still on basis of IHC, histo, we cannot label it as malignant MEST कि हमने ये देखा benign component नहीं है तो हम benign component है तो हम sarcomatoid या renal sarcoma नहीं कहेंगे, तीनों element नहीं है तो हम adult wilms नहीं कहेंगे. We need to confirm it with help of immunohistochemical marker. ठीक है? तो IHC पे first is जो CK7 और हम जो pan-keratin होता है AE13 वो positive होगा in sarcomatous area. ठीक है? Then epithelial markers positive in even undifferentiated sarcomatoid RCC with no epithelial component. Now malignant MEST हमने कैसे rule out करा? Epithelial component जहाँ में दिखे वहाँ हमारा CK7 positive आया, AE13 positive है, EMA, CD15, CD10, Vimentin. So these all will be positive in your epithelial component. Stromal will show positive for SMA, desmin, myogenin, S100, BCL2. So primary renal cell sarcoma will give you positivity for BCL2, Vimentin, CD99, 56 and epithelial membrane antigen. Adult Wilms tumor is positive for CD56, 57 and WT1, that is Wilms tumor 1. So you need to remember these basic IHCs. How will you differentiate? So when we applied, in our case, जो present case है हमारा, हमें positive मिला Vimentin we got in both epithelial and stromal component which was showing in the MEST differential table. Then CK7, AE13, CD10, 15 EMA we got in epithelial component. जैसा हमने दिखाया है इसमें, ठीक है? Fine. So this and Ki67, this was highly proliferative tumor with Ki67 index of 60 to 70%. So these are in concordance with what we see usually in MESTK, which I had shown you in the differential table. Negative थे हमारे ये सारे markers. WT1 5699, WT1 was negative, Wilms tumor out. 5699 renal synovial sarcoma out. So these are the thing. और जो benign component नहीं था sarcomatoid के favor में नहीं था हमारा. So with help of histo and IHC we could confirm that this is a malignant mixed epithelial stromal tumor of kidney. So see, these are the positive picture जो हमने discuss किया. ये epithelial component है, ये सारे tubules दिख रहे हैं ना, sorry, epithelial component दिख रहे हैं आपको ना, cell जो malignant area दिखाया था मैंने आपको histo पे, जहाँ malignant cells were arranged in papillae and micropapillae. So here you are seeing CK7 positivity, here you are seeing a focal AE13 positivity, Vimentin positivity, EMA positivity focally, CD15, CD10. So brown deposition होते हैं, these are your IHC. So these all 6 markers were positive in the epithelial components. Now coming to stromal component में Ki67 is highly proliferative tumor, positive है stroma में, और Vimentin भी positive है stromal areas में. So malignancy is confirmed in both epithelial and stromal component. Okay? और ये सारे negative markers हैं, desmin, SMA, कुछ areas लेते हैं जो वो होता है, but we need to focus on which area we want to see the IHC. कहीं भी unrepresentative area में अगर positive आ रहा है, you will not consider it as positive. जैसे अगर हमें जो हमें stromal areas देखने हैं वहाँ अगर negative है तो S100 is negative, 56 is negative, BCL2 is negative, CD99 is negative, CK7 is negative in stromal component, ठीक है? So in this way you can see a control भी है, internal control का काम कर रहा है कि your CK7 IHC is good because जो epithelial component है वो ले रहे हैं stain. So that is not our concern. It is not positive in stroma, right? WT1 is negative. So it is Wilms tumor नहीं है. So finally we arrived at diagnosis of carcinosarcoma. भी कह सकते हो इसको जब आप mixed epithelial stromal और malignancy. So it is a carcinosarcoma or malignant mixed epithelial and stromal tumor of kidney. And that too हमने variants भी पता कर लिए. जैसे हमने RCC में CD10 लगाया था ना, so this is a papillary renal cell carcinoma of kidney along with fibrosarcoma. Staging T3 tumor है, node 1 involved, nodal 1. There was no mets. अभी हम extensive हमने study नहीं किया, ठीक है? On the basis of your clinical, histopathological and IHC finding, this is diagnosed as carcinosarcoma or malignant MESTK of kidney. So this MESTK, it's a rare tumor और Michael and Salutis ने in 1998 report किया था ये first renal tumor. Biphasic tumor था, composite tumor कहते हो आप because you have both epithelial and stromal component. Previously reported as adult mesoblastic nephroma, cystic hematoma of renal pelvis, solid and cystic biphasic tumor of kidney. ठीक है, यूजुअली पेरीमेनोपॉजल फीमेल में अफेक्ट होता है ये और अराउंड मेनोपॉजल एज male female ratio being 1:6, and officially in 2004 WHO classification of tumor MESTK was adopted officially. Okay, and majority of cases behave in a benign manner. And mitosis is almost never present, and Ki-67 is very low in case of benign MEST. हमारा तो 60 to 70% था Ki-67. Mayer ने classify भी किया है carcinosarcoma in 3 histogenetic groups. One is collision tumor. कि coincidentally arise हो जाते हैं दोनों, carcinoma भी sarcoma भी, in a tumor and they invade each other. ठीक है, or it could be a combination tumor. Both arise from their pluripotent stem cells. Then composition tumor क्या होता है? They are derived from the same tissue. So these are the basic of histogenetic background क्या है tumor का? Collision, combination or composition. Fine. So now basically जो existing theories हैं कार्सिनोसार्कोमा को कैसे describe करती है? They describe it as a monoclonal origin from a common stem cells. So presence of characteristic जो epithelial, where I showed you a picture जहाँ पे tubules से और stroma उसके surrounding में है. So that is stromal cuffing. That is an important clue in the diagnosis of malignant MESTK. And it is a highly aggressive tumor with a 5-year survival rate of just 20%. True survival हम नहीं कह सकते because we don't have much cases, and unless you see number of cases and just sufficient number of cases, then you can this on follow up आप देख सकते हो कि इस tumor की prognosis, diagnosis मतलब prognosis क्या है, 5-year survival rate क्या है. It needs a long term follow up, but lack of long term follow up की वजह से true survival exactly इस disease का भी it is not described. So see, extensive review of literature we had done, and this was a very, very special case which I had done under Dr. Meenakshi Bhardwaj ma'am, my ex-HOD in RML. When I was doing my senior residency in RML, she was our HOD, and it was, in fact, I can say, patho became a passion with few of my professors, and among them, Dr. Meenakshi Bhardwaj is such ma'am, and I really, really respect her a lot. Because this case, I tell you, we took around 21 days on follow up. हमने इतने आए थी because हमने first rule out करना सीखा ये कैसे report kidney tumor है, ये marker वो marker. See, because of economical constraint also, and you cannot waste IHC antibodies. ठीक है, तो we need to make a proper flow chart. और आप देखते हो कि ये marker वो marker, and when you are 100% sure, and I think for this case, ma'am used to come very early in department. So in fact, that inculcated a sense of discipline among us also. So we used to start our morning with this case every day for I think for approx 2 weeks minimum. तो हम हर रोज सुबह 8:45 इस केस पे लग जाते थे, and then we used to say this marker, those marker, and those markers and this marker. So we used to keep like we had a very good healthy discussion. मैं पढ़ के आती थी, मैम खुद पढ़ के आती थी to label a rare tumor. So we need to have an extensive research. Fine. So बहुत लोगों ने किया है research इस पे, cases publish करे हैं. जैसे स्वैक टॉल फीमेल में करा है one, and he got undifferentiated synovial sarcoma. हमारा rare क्यों हो रहा है? क्योंकि हमारा component जो आया था ना RCC में we got papillary RCC, and then in stromal component we got fibrosarcoma. Fine. तो फाइब्रोसार्कोमा मिला हमें. तो दिस वर नॉट फाउंड इन बिफोर. एक और कुरोडा एट ऑल ने करा था, उसमें मिला था एडिनोकार्सिनोमा और मिला था अनडिफरेंशिएटेड सार्कोमा, कॉन्ट्रोसार्कोमा, रैब्डोमायोसार्कोमा. ही गॉट मल्टीपल कंपोनेंट्स. Our it was papillary RCC and it was fibrosarcoma. So this rare entity, this was there in our case. ठीक है, patient was given chemo and radiotherapy. Follow up of 5 months was there, but patient succumbed after 5 months of follow up. ठीक है. An extension was there of this tumor in the perinephric fat capsule in hilum and upper pole also. So diagnostic criteria क्या होता है इसका? Epicenter of the tumor should be in kidney, and there should be a clear-cut evidence of benign epithelial and stromal component. ठीक है? And morphologically जो होता है ना, malignant component should be intimately associated with the benign counterparts. कि benign में epithelial stromal component दिख रहा है, उसी का counterpart benign में और stromal में हमें malignancy भी दिख रही है. And renal sarcoma or any METs should be ruled out before you label it as this. That's why extensive IHC and extensive study is required. So to conclude, this is a very rare case and a proper histopathological examination along with the detailed immunohistochemical markers needed for a definitive diagnosis of malignant MESTK. This is a recently recognized entity with very few cases reported in literature. और इसमें बहुत लोगों ने बिनाइन किया है, किसी को एक में मैलिग्नेंसी मिली, किसी को दोनों में मिली है, बट डिफरेंट एंटिटी मिला है. हमें जो मिला मैलिग्नेंसी वो दोनों कॉम्पोनेंट में वो एक यंग में मिला है, ठीक है, एक यंग मेल में. दैट वाज रिपोर्टेड इन फीमेल. एक और जो केस मैंने आपको दिखाया था चार्ट में कि दोनों में मैलिग्नेंसी थी. So that was reported in a female with adenocarcinoma and fibrosarcoma, chondrosarcoma. Ours was a male, young male. एक फर्स्ट तो रेयर ये हो गया कि फर्स्ट टाइम मेल में रिपोर्ट हो रहा है, एंड दैट टू इन टू कंपोनेंट्स मैलिग्नेंसी वाज देयर. वन वाज प्राइमरी आरसीसी एंड दूसरा वाज फाइब्रोसार्कोमा इन द स्ट्रोमल कंपोनेंट. So histogenesis and clinical behavior of this unique malignant neoplasm. This needs extensive reporting of more cases in literature to add to the literature, and then we can arrive at a true survival rate for this tumor. So these are my references. Thank